Welcome to Nursing School Explained, and this video on anesthesia. And the term itself already tells us what this is about. Anesthesia, without the AN, just means the capacity for feeling or sensation. And as we know in medical terminology, an always means without. So this is without the capacity of feeling or sensation. And if you know anything about anesthesia, is during surgery, you really don't want to feel anything or be aware of anything that's going on. So the goal is always analgesia, so pain control, muscle relaxation and or paralysis, and amnesia. So we can achieve all those three things with general anesthesia. And general anesthesia is usually performed in the operating room, where the procedure is going to require a significant duration and or an uncomfortable position for the patient. So think about this as a patient who requires spinal surgery. We definitely want them to have no pain. We want their muscles to be completely relaxed, because this might be very microscopic, millimeter by millimeter movements that the surgeon has to accomplish here. And we certainly don't want the patient to remember anything about that surgery. So you will want to take away their ability to remember that. And general anesthesia involves the rapid loss of consciousness and loss of sensation to accomplish all three of these. And medications that are generally used here can either be IV agents and inhaled agents, or both. And so for IV agents, those can be neuromuscular blocking agents. Sometimes we refer to those as paralytics, and those are your rocuroniums, your succinylcholines, those type of medications. Any kind of inhaled gases, narcotics, certainly for pain control. And then barbiturates sometimes are also used, and an example here would be phenobarbital. Now, when we take away the patient's pain, sensation, and any kind of feeling and capacity to move, we have to always worry about their A, B's, and C's, because now if we take away their ability for their muscles to work, that also includes the muscles of the respiratory apparatus, and so we have to breathe for them. So for the airway, that'll usually be taken care of by an endotracheal tube or a laryngeal mask airway, which is similar but a little bit different. B, breathing, they will be put on a mechanical ventilation because they will not be able to breathe themselves. And for C, for circulation, so we want to make sure that we keep their blood pressure up, especially if we expect a blood loss, maybe even have blood products there to be administered, and any kind of blood pressure agents that will help us raise the patient's blood pressure in case if it's needed. And for general anesthesia, A, B's, and C's will be taken care of by the anesthetist or nurse anesthetist. So this is a very detailed specialty that this particular team member will take care of the A, B's, and C's of the patient. Now, the nurse's general role is the pre-op assessment, making sure that the patient has met all the requirements that there are for surgery, that the consent is signed, that the surgical timeout has been performed to make sure we have the correct patient and we're going to perform the correct surgery on this patient. Apply any kind of monitors that will mostly be vital sign monitors as well as cardiac monitors. We will also assist with A, B's, and C's, so with the intubation, maybe the ventilation management, any kind of assistance that will be required there. The nurse's job is also to position the patient and monitor the patient for safety. Also the assistance in any kind of application of a dressing, and then moving the patient to the PACU, the post-anesthesia care unit. Now, complications from general anesthesia, as you can imagine, can be numerous, and the risk kind of increases with the duration of the anesthesia. And so one of the most worrisome complications is malignant hyperthermia, and I'll go over that in a separate video. But the patient can also acquire pneumonia or VTE, venous thromboembolism, a blood clot from this prolonged duration of not moving and then maybe being in an uncomfortable position. And then post-op, always possible nausea, vomiting because of the different medications that the patient received. Pain certainly will have to be managed. They might have a sore throat from the artificial airway that was inserted, and there might be some confusion because of the analgesia and the amnesia that we're causing with these medications that we are administering. So general anesthesia is always a team effort, and not one person can do this alone. So the OR team will come together, but it's important to understand the difference between general anesthesia and then sometimes what's referred as moderate sedation or deep sedation or procedural sedation, which is similar but different. So make sure to watch the other video to stay informed on that procedure as well. Thanks for watching.